Welcome to the Faculty of Health here at the University of Technology, Sydney. Our targeted research tests innovative public health approaches to addressing modifiable risk factors that are at the heart of the rise of chronic and complex diseases. We deliver research to enable equity of access to healthcare.
We know that domestic and family violence is a dreadful stain on society, and because of the impacts that domestic and family violence has on someone's health. It has terrible detrimental effects in their emotional well-being, in their general health, and their physical health. We can try and address all those problems, but we've got to fix what is causing those behaviours.
So as we all know, refugees are survivors of trauma and torture, and they experience a disproportionate burden of health issues, among them including nutritional deficiencies, mental health issues, chronic diseases, as well as under-immunization. So being a migrant myself and having faced challenges in navigating the healthcare system, I can understand the issues that they face, and I feel like I need to play a role in improving the outcomes for this population.
Humanitarian crises cause mass disruption and displacement of people that has significant ramifications for their health. And the Pacific Islands are one of the most vulnerable regions for cyclones and for volcanoes. When people think of a disaster, they think of, the need to bring food and the need to mobilise resources to provide shelter. But of course, women still remain pregnant. Rape is still existent in society. So this puts women and adolescent girls at great risk of unintended pregnancies, sexually transmitted infections, and HIV.
Stuttering affects 10% of the population of the world at any one time, so there just are not enough speech pathologists in the world to deal with that issue. If you grow up with stuttering, it may prevent you from getting the job that you want to have, and it may also prevent you from getting the education that you would like to have. You might well encounter social anxiety, and that can affect your communication. Our vision at the Australian Stuttering Research Centre is to provide accessible treatments for children and adults who stutter around the world, regardless of whether they can access a speech pathologist. A key way is by developing online treatments, and so anybody around the world who has access to the internet can receive treatment.
I want to put it out there that refugees are not a heterogeneous group, and so if you want to make any changes, you need to work with them. We need to mediate, advocate, as well as enable refugees to make a change in their communities.
This research is really about building the capacity of countries. So building skills, building networks, building systems to address their own preparedness and response.
The major challenge for people who stutter in society is that society marginalises them with negative stereotypes. The final product of our research, we would hope, is for those stereotypes to disappear.
Whatever research, whatever work we do, we need to be collaborating with different organisations to try and find a multi-agency response. And really, I just want the day to occur where we just don't have any domestic and family violence deaths.